My name is Blair Gordon, and I will be your host for today's conference. My company name is Gestal Swine Systems, and I am Gestal's dealer for the province of Ontario, just west of Quebec in Canada. Today's conference is about sow mortality, and our speaker is Dr. Carlos Piñeiro. Our program today will be in two parts. The first part is a presentation about 30 minutes, and the second part will be a discussion panel. We invite you to submit questions in the chat box. These questions will be answered by either the presenter or the panel. Before I introduce the speaker, I want to thank our sponsor for this conference, Demeter and Nutrition Athéna. Thank you very much for your support. Now let's get on with the conference. Carlos Piñeiro is a veterinarian working at the swine research farm near Segovia, Spain. For the past 18 years, he has been the director of PigChamp Pro Europa SL, specializing in information systems in animal production and health. Carlos also does contract research on commercial farms in the areas of production, food, health, management, welfare, and the environment. Dr. Piñeiro is an expert in data management and the analysis of productivity and health. What he likes to do, though, is blend classical field science with the proper use of data. He also managed more than 20 national and international applied research projects. Carlos is responsible for 23 publications in scientific journals, more than 100 papers in scientific conferences, and 5 chapters in books specialized in production, health, and the environment. Without any further delay, I give you Dr. Carlos Piñeiro.
Thank you very much, Blair, for the kind introduction. It's for me a pleasure sharing this time here with you, talking about one of the concerns that we have in the industry right now. And I will try to share my experience together with some data that help us to understand better how to deal with this, how to do this better. So we can see from now on, and during the next 30 minutes, what is affecting this major problem that we have, how to cope with it. This is based on the sows. Today's sows are different. We'll try to understand better what leads a sow to die, which is the economic impact also, and see which has been affecting this in the last years, and this and which are the major risk factors. Some comments about the lessons associated, and most important, what can we do about this? How can we improve this concern, this problem? Well, I think that it's not surprising that I start saying that sows are different today. Sows are different for a number of reasons, but they are different because initially they are bigger. This means that they have higher maintenance requirements, but they are more productive. And this means that they have higher requirements also either for fetal development in gestation and higher requirements for milk production and lactation, because they have more piglets that we expect to be heavier at weaning. But we were not very useful in terms of increasing the feed intake in these sows. In general, we know breeds are different for many things, but in general, we're not very useful doing this. So there's a lack of energy and nutrients intake, and this is a higher risk of not covering these needs. And overall, there's a higher variability than ever in terms of performance and requirements. Sometimes we say we need to feed good the sows. Well, what sows? What breed? The younger sows, the older sows, the gilts. It's not only difference among sows because of this, but also among farms, because every farm is using a different breeding line. The health status that has a major influence, the type of facilities, the type of management, also the impact of weather and seasonality. We have seen that in the last decades, of you that probably have seen what's happened in these last decades, you remember that in the 80s and the 90s, 20 or 20 something piglets per sow per year was very nice. Now you have to be 30 or over 30 to keep on being competitive. The litter growth per day, it was about 2 kilograms in the 80s and the 90s. Now we go around 3 or over 3 kilograms a day. But we have seen that survivability of the piglets have not really changed. It's about 80% 3 decades ago or today. But we have different animals and in terms of productivity, but this means also certain problems. We have seen, and initially we have the feeling, later on I will provide some data on this, that mortality, the percentage of dead sows and the euthanized sows is growing. This has been referred by a number of scientific papers in these last years. The replacement rates are becoming higher and higher, and it's not strange go over 50% and even 60 something percent in certain farms. We see that litters are less homogeneous. There's higher variability, not only because we have smaller piglets. Some of them have a lower viability because they are related to what is called intrauterine growth retarded, with this dolphin-shaped head. Preweaning mortality is also growing, probably related to this. Also, it's clearly growing and is increasing. There's an increased number of non-productive days lately, not in lactation, like the number of productive days or non-productive days, which is the opposite, is basically the same, is stable. But we see that the number of productive days in the last 5 years is decreasing up to 7 days extra non-productive, which is a big impact, about $3. The cost is about $3 a day. Only this is $21 per sow per year. But why a sow is dying? What leads a sow to die? It's not something that happens randomly or by chance. Well, it just happened, died and happened, and that's it. No. In most of the cases, it's related to what we call the stress and stressors present on the farm. And in stress, there's a number of definitions. I like one very clean and straight, which is the biological response that we see in an individual when there's a threat that the individual perceives to his hemostasis. Good has no consequences. This is very uncommon and normally has consequences, and it's called distress. And the consequences are on welfare and health and reproduction and productive performance. The first response is behavioral, escape or stay there, fight or flight. And if there's a response, it's a complex response that is involving a number of systems, including the central nervous, the neuroendocrine, or the immune one. And this is because of these stressors that are present all the time, and normally not alone, but in combination during animals' lifetime, during sows' lifetime. There are social stressors because we mix the animals, we group the animals, in this case, sows, we can group it and in gestation, or we don't respect the stocking density. Immunologic stress, which is probably one of the best defined, basically diseases, viral, bacterial, or mixed diseases. This is an enormous stressor, very well described, as well as transportation, that the distance and the quality of the transport is affecting the response on the animals. There's also physiological stressors. A farrowing is an stressor. Weaning the piglets is also an stressor. Certain routine procedures such as castration or tail docking can generate also this stress, physiological, because of submissive sows. They have the pressure because of the others, or sometimes animals feed the workers if they are not doing well, or very well described environmental ones, because temperature goes over or beyond the threshold, or humidity or light or whatever. All of them generate the so-called acute phase response. And it's not something that happened or not, it's a graded impact. That means that if the animal cannot escape, start the consequences. A few grams of growth that are lost, a few grams of worsening feed efficiency, mild symptoms or subclinical symptoms that if it's going beyond and is worsening, we start seeing serious decrease in growth, loss of feed efficiency, clear symptoms that if they are still there and the animal can't overcome this, lead to death or euthanasia of the animals. And the economics of this, it's something that has been there from years ago. The impact is it's easy to understand. There's a direct loss of the value of the animal because the animal dies and we have lost that value. But there's also an opportunity cost because we have lost the opportunity of the benefits that that animal is going to generate, keeping the census of the farmer stable, etc. And we have to put some guilds in, some more guilds in, and this is a risk because of health reasons mainly, etc. Besides of the cost. It's generally well accepted that a sow pays for herself from third party onwards on farrow to finish farm and fourth party onwards on farrow to win farms, with the highest returns on parity 5 to parity 9 with about 15% of net return, as Gruhot described about 4 years ago. Other two figures that describe very well, and I have been classically used, is that every 1% of sow mortality means 0.25 piglets extra per female per year, or about 22 USA dollar cents per piglet produced. But there's a recent reference that I like very much from Ketchem in this year, and refer from Jim Long of Genesus also, that is going beyond, and it includes the development of the gill, the feed cost, the vaccination cost, the lost litter of pigs, the cull value, and this reveals about $1,000 per sow, which is probably an impact higher than many of us would expect. This is not only a feeling, this is something that is really happening. During the last years, we have performed an analysis. We have a database of customers, the customers that are working with us, over a bit over 500,000 sows. And we have seen that from 2014 onwards, something has changed, and have changed in a significant way, not because we see that this is going up. There's a significant effect on this increase of mortality, and there's also a seasonal effect. I mean, sows are not dying every month the same. In our case, these are data from Spain and Southern Europe mostly, is highest in August, which is the hottest month, and November, which is normally one of the mildest months of the year, where we can see the lowest mortality. In general, it's not clear. We don't know very well what is behind this. The picture is very similar to what we have seen in other studies, USA across, from SMS, a study that is in the same period from 2013 onwards, almost double, from 5.8 mortality percentage to a bit more, 10%. And if we apply predictive analytic techniques, the figures tell us that this is likely keep on happening. We should expect a light but steady increment if we do nothing, and we better do something, because of course it's not something that we desire to have this. We run a comparison with a good number of farms from our customers in Spain and with the PigChamp customers in USA. We put everything together and perform a very in-depth analytics to see if there is something behind the data that are able to tell us and understand better this. And we have seen that the percentage of dead sows in Spain is lower, about 3 points. That the percentage of female cells per year is higher, about 7 points in USA, with lower sows, about 0.7 parity sent to the abattoir, with almost 9 more productive non-productive days, which means considering $3 each, about $27 in US. And despite this all, we are able to produce almost 1 piglet more in about 0.8. Of course, if this represents one of the other productive systems. It's not the whole country, of course, but I think it's a good representation with a good data treatment. We can see here that this 3% represent this 0.8 extra piglet, that is this 0.25% that I mentioned before. So it's matching nicely. So based on this, we would like to understand more, to do more. So we start working with with data, with customers to see which factors are affecting more. Is parity relevant? Does season matter? Is related to the productive performance of the sow or of the herd? In that case, how much? Can we get something quantitative, not only yes affect or not? So we ran a study, including a good number of farms with more than 500,000 first served records. So we put everything together and try to understand this. And we found a number of risk factors that explains this better. The first one is that we found that sows die more in a certain moment. And this is around farrowing and during lactation. You can see here the mortality risk. And here the weeks pre or post farrowing. This is the mating week. And we can see that the risk of dying is around 2% during the whole gestation, but it's peaking the week before farrowing. And it's going up to 4 or 5 times until the end of lactation, and again decrease. So we see that there's really a period where there's a higher chance of a sow to die. About the parity, we have seen that there's again a clear pattern, more pronounced in lactation than in gestation. But if we look at gestation, we see that there's a U shape, and P0 and P1 younger sows and the older sows are dying more, and same in lactation. You see this U shape more pronounced. It's also related to the performance of the herd. It seems that when a herd is not performing well, the risk of dying is higher. And when we think about that, it's something in a way logical, because a herd is not performing well because they don't take care of health, they don't take care of nutrition, they don't take care of management, they don't take care of a number of things that at the very end influence the performance and influence the mortality. In fact, we can quantify that the risk is about 50 to 60% higher compared to ordinary performing herds. You see how clean is the effect. And this is something that you can see in every parity. Here, you see the difference. This is the probability of a sow to survive or to die. 1 means that the sow, the gilt in this case, is going to live for sure, and 0 means that it's going to die for sure. You see that in the weeks post-mating, over time, how this probability is going down, and is lower in low-performing herds, either in gilts or in P6 sows. So there's an effect related to that. And of course, I mentioned before hot season. When we split the year in quarters, we saw that the lower mortality risk is in the mildest quarter, October to December. The highest is in the warmest one, and the others 2 in between. So it seems that it's clearly related to the mortality of the sows. But we try to go beyond, 1 step beyond, and recently we published this paper in the Journal of Animal Science, and we put together reproductive data with weather data. IMET is the Spanish agency for weather, and we put together the data of every farm with the closest weather station to that farm and see what was the impact. So trying to quantify what's happened because of the temperature in all of the KPIs that we could, including winning to estrus interval, prolificacy, farrowing rate, etc. And we saw a good number of interesting things. Of course, we found that temperature affects results in a very important way. Of course, there's an inverse sensitivity relationship with the number of winds, something that we didn't expect. Gilts are the most sensitive, and this could be related with what we have seen before. Younger sows die more. We have defined some cutoff points from what temperature something changes, something happens, because this is leading to some practical implications, something that this is not just an intellectual exercise and intangible. No, we want to deliver practical insights for the producers. We have seen that using logistic regression as we use, we can predict certain things, including winning to mating interval and some others. And how clear is this effect based on the daily maximum temperature, how this is affecting all of these KPIs? I've just chosen one, the farrowing rate in here, but you see how different is the behavior of mature sows or the young sows, and you see the slope of every of the curves. This was a little surprise because a stillborn is related to the risk of death at any parity, because we have seen that no stillborn or up to 2 piglets stillborn, there's no effect. This is not increasing significantly the risk of a sow to die, not at that moment in the lifetime. And this is happening at any parity, as you have seen. There's something that's happened, but when you see these 3 or more piglets, the risk of dying multiplies almost by 2.5 or 3, depending on the parity. Why this? At the very beginning, we were not very sure, but a stillborn sometimes are related with a problematic farrowing, sometimes an infection, sometimes a dystocia, sometimes something that could lead to a later problem. So this is something that is very related to the probability of a sow to die later on. What do we find in a sow that have died or we have euthanized at farm? There's not so many studies that have reviewed this part properly. I like this in particular, this Finnish study, which is quite recent. It's from 2019. And it's interesting because the first statement of the authors is that they say that there's no methodology or protocol standard to deal with this topic. They used 15 farms and up to 65 sows, very carefully necropsied, thoroughly necropsied, and they define the primary and the secondary reasons around that. The primary reason is a reason that explain or could explain why a sow died, and the secondary reason is a lesion that is there, but quite likely is not explaining that a sow died. Besides of this, and describe the pathological findings, etc., they also ask farmers and vets about what would be the reasons that they think of the sow before dying or before the euthanasia, with some interesting results, as you will see later on. Well, the study is describing, well, a number of things more related to problems in younger sows or in older sows. Inflammatory diseases are more present in older sows, up to 50% of them, 48% of them is related to this. Inflammatory, locomotor, and cardiogenic are more related in younger sows in parity 0 and 1. But one of the most interesting things is that these postmortem findings associated with locomotor system in 91% of the times with more than one type of lesion in more than one location. This is starting telling us that there's a lot of challenges in form of lesions in the body of the sow's necropsy. It was interesting, and again, that all but one sow had another type of lesions that are not theoretically able to generate a death, but that are present there. All but one sow. And the most common findings, and this for me was one of the surprises, that 71% was tooth-related, tooth wear, periodontal disease, fracture, or calculus, and almost 2/3, 63%, shown osteochondrosis. These degenerate joint diseases. This is a picture that I took in a necropsy of a sow, and the first thing that you think when you do this is, well, I made a mistake with the knife and I generated this. No, this is a case of osteochondrosis, in this case severe, that is present based on these authors in almost 2/3 in different degrees of the sows. Of course, there's some others like skin lesions or decubital ulcers or pneumonia cystitis, but are less important compared to these two. Something that now every time that I run a necropsy on the sow is something that I think that we have to pay more attention on, that is to look at the teeth. If we see that, or we accept that 70% of the sows have tooth problems of different types, including fractures in up to 25%, normally several teeth, this increase with age, periodontal disease, like in people, 26% of the cases with periodontitis, gingivitis, loose teeth, or calculus. Normally, these are painful situations that could be related with lower intake or no intake situations that we see that is something that we don't understand. Why this sow is not eating? Well, probably we have to pay attention also to this, despite it's not very much what we can do. But the other part is lameness. Lameness is the most cited, not only in probably in every vet experience, but in the literature related to this problem of a lower retention of sows and deaths. Mostly osteochondrosis of different degrees, mainly in front legs or both legs, front and rear, and mostly in shoulder and elbow. Many people are thinking that arthritis or infectious diseases is the main reason. Of course not. We have to pay attention to this because the bigger percentage is related to this. And it's kind of a vicious circle, because when we have lameness, we have low feed intake because of the pain and the bad mobility, degenerative stress, normally behavior altered. There's a weight loss, back ulcers, shoulder ulcers, hormonal disorders, weak heat on anoestrum, with more medicines used, poor fertility. It's feeding back all of the time, but at the very end, it doesn't matter that we start with one corner and follow until the other corner, or the opposite, but at the very end, this increases the risk of culling or death the sow. And when we say lameness, is a very general thing, a lame sow. Well, a lame sow is not a lame sow. There are at least 7 reasons that can lead to lameness in a sow. Osteochondrosis is the main one, heels overgrowth, white line lesions, hoofs cracks, vertical and horizontal, heel sole crack, overgrowth and laminitis, and of course, infectious lameness. This is just a very minor percentage, but it's important, is there. So you have to take this into account, but because every lesion is telling a story, could be related to management, could be related to nutrition, but all of them lead to that. Which is the impact of lameness? Very high. Another revision using, again, almost 500,000 of recordings about the sows that were culled because of recent lameness. We see that the parity at removal was quite lower, 3.4 versus 4.9. The lifetime number of piglets delivered, it was much lower, 41 something versus 60 something. Number of lifetime piglets weaned, 38 versus 54. And if we take a look to other averages, including per parity, wean to first mating interval in lame sows is higher, 6.5 versus 5.8. Lower number of piglets born alive, higher number of stillborn piglets, lower number of piglets weaned. And this is the impact of what we see. We see a lame sow and we record as a lame sow. But sometimes it's, remember, that graded effect, but sometimes it's not so strong enough or clean enough to record as a lame sow or euthanize as a lame sow, but is able to lose some follicles or ovocytes or a bit less milk, etc., that is impairing production. The summary is impressive. We're losing a lot of piglets because of this, and probably this is underestimated for the reason that I have just explained. Short comment about euthanasia. In this case, it's heavily clustered in the days between weaning and insemination. It seems that we are waiting to wean the litter, and that is what matters. Therefore, we can, of course, cull the sow or euthanize the sow. The body condition score of these sows is much lower compared to spontaneous deaths. And the clinical signs most frequently observed because of this, these authors of this Finnish paper, is again lameness, inability to stand up, which is basically the same and very related, and inappetence that could be related to the pain, or could be related to these tooth problems or whatever. And interestingly, more than half of the times, the prior diagnosis of that reason to euthanize the sow was wrong, and almost 30% only partly right. 50% of the times was right. So this is telling us that farm managers and vets has not very, in many times, the right idea about what is affecting the sow. I would like to tell you about one of the stressors, because gestation period should not be a stress period at all. In many cases, I understand that people don't like electronic feeding equipment because it's generating problems. And until now, what we have been using is not the best. It's not the best option. I would like to show you a short video that shows the type of stress because of feeding that if the electronic system is not the right one or is not well designed, can generate. I will keep in silence because I would like to you to hear, not only to see the sounds, but to hear that. You see that the animals are screaming, they're biting, they fight to get the feed. This is what we have in our farm and in some farms of our customers in this period that you see here, the over time evolution of mortality. And when we have changed to groups, smaller groups and better managed groups, mainly related to the use of Gestal, we have seen that this indicator, the mortality, is clearly going down from an average of 13–14% up to about 7 to 8% that we are right now. So avoiding stressors, as I have mentioned before, and the gestation phase must be a low stress period, and a gestation barn must be a silent barn. It's something that sometimes we don't pay attention to that, but it's really important. And it's something that is not only a feeling, it's not only a few data that I am presenting. This is a good paper from Ohio State that they published it from 2018, and they assess these small groups and this system. They use, again, the Gestal 3G system, and they were not able to find a negative impact either in the litter or the female productivity because of the use of electronic sow feeding using this. With others, of course, this happened, and they state clearly because aggressions were decreased. The mean biting bouts, as you can see here, were decreasing in gestation period over gestation period. So it's something that we can see very, very clearly. Final comment about lactation period. It's probably the most demanding period. It's amazingly demanding. In fact, it's metabolic stress what is there, because current litters are growing 3 kilograms a day or even more. This is 3 times what a good finisher is growing. That could grow 900 grams or 1 kilo a day. Sow is generating 3 kilograms a day in terms of meat, in terms of milk production. And nutrient intake normally does not cover this. It's very difficult to cover this, and it's 70 to 80% in optimal conditions. But a sow in less than a month, from 21 days normally in USA and Canada, and up to 25, 26, 28 in Europe, is generating 30 to 40% of the body weight in a single lactation. It's amazing. So we have to deliver a good number of good nutrients, protein, lysine, calcium and phosphorus, vitamins, etc., and transform into those kilograms of meat per day. If we are not able to do this, it's something that it's going to generate problems like this type of ulcers, shoulder ulcers. If the system is not well chosen, is not well managed, is done by hand and not properly done, it's something that we're going to find this, and this has very important consequences. It's interesting because the companies, Dan Bread, PIC, is telling your sows must eat this way in lactation, depending on the parity or whatever. This is what Dan Bread is telling, whatever. About 20-something years ago, it was published a beautiful paper describing from this Japanese professor that sows eat in lactation in 6 different ways. This is the most common one, as reflected in theory from the breeding brochures. But the interesting thing is that this professor described that 2 of these patterns has later consequences on the subsequent cycle. A longer wing to mating interval, lower number of piglets, etc., and with a low repeatability. This means that every sow is eating as she pleases. So this is something that is not as straight as we would like to. When we look what some of the systems that we have in the market right now, like Gestal Solo, which is is really a beautiful system, we see that this professor was right 25 years ago. And we can see that a sow is eating this way. In blue, you can see what the sow is eating, correct, risk, etc. This is a good sow. A problem with mammitis, metritis, or agalaxia, going up and down, poor intake, or even a reaction to the vaccination. But this is related also to the number and the size of the follicles that at that moment are being generated for the next cycle. We can see here bigger and more, and a lower number and smaller if the sow is not eating not only the right intake, but with the wrong pattern. So in summary, this is a global growing problem that tends to increase, doesn't matter where you are, Europe, North America, South America, Asia. It's a direct loss that reflects a number of other things. It's not that an animal died. There's a lot behind explaining quality of production. And deaths are a consequence of these cumulative stressors of different types. So what we need to do is avoid these stressors using this straw deliver systems can help a lot, or if we can avoid that, these are gills and this is in the hottest period. So avoid these risk factors that we have mentioned, or pay attention to that. Use the best barn, the best ventilation for those more sensitive animals. Pay attention to the younger and the elders on the older sows. Be more aware if you're dealing with low performing farms, or be aware with those sows that are delivering a stillborn in a higher number. What we can do, and with this I finish. Well, mainly we have to try to anticipate, focus on the risk factors that we have mentioned, pay attention to the farrowing rooms, since we have seen that are more thought for the piglets than for the sow. Review the legs, the claws, pay attention to the stillborns, pre-check the sows and the gills and mark those that are higher risk. In a single sentence, put your data at work for you and be prepared for that. Pay a lot of attention to the pre-mating period, the racing period of the gills, not only with good nutrition, proper microminerals. Never ever give the growing finishing feeds that are used for finishers. Record data, because sometimes it's a forgotten phase. We don't know anything about gills, and it's very important to record the age, the heats, different types of health problems, and in general, promote better welfare to the sow. Those stressors are a heavy challenge, and not only because the animal could be suffering or not, and you're more happy of that, it's ethics. No, it's that the energy and the protein and the amino acids that you're spending your money are waste, because the animal is using to overcome the stressors and try to minimize also this continuous or chronic pain that can be found in certain periods, and involve farm staff always. Without them will be not possible. They need to understand the sows. We need to train them to understand the sows, promote empathy to the animals. Detect the early signs of every kind, early signs of lameness, early signs of pain, early signs of fear or submission. In Spain, we say that sometimes we don't see the wood for the trees. The sows are in front of us all the day, and we are not able to see what they are telling us. So we really need to, in group sows, to understand the animals and provide this better welfare that at the very end is better production and more efficiency, and of course more competitiveness. Remember that Europe is having the highest standards for welfare with group sows, and now we are able to produce better than ever. So it's something that we don't have to fear, and in particular with these systems that are very well proven, we can really change without having a big problem. So thank you very much for your attention. I hope that some of these comments are useful to you to understand better this problem, so we can control and improve the efficiency of production and the productivity of our farms. Thank you very much for your attention.
Once again, everyone, thank you for attending the sow mortality program of Gestal Swine Summit. As I mentioned in the beginning, my name is Blair Gordon, and I will be the moderator of the following panel discussion. First, I would like to thank our sponsors of today's program, Demeter and Nutrition Athéna. We thank you sincerely and appreciate your support of our summit. Now I'd like to invite all of our viewers to send in questions to our panelists. If you want your question directed to a certain panelist, please make note of that. Please use the Q&A section at the bottom of your screen and not the chat icon. First of all, to maybe get things started, I thought I'd throw a question of my own out to the panelists, and whoever would like to take it, feel free. If I was to ask most nutritionists like Dan what the cost of 1 point of feed conversion was worth in a 4,000 finisher barn, I'm sure he could tell me. So this is my question. What is a 1% reduction in sow mortality worth in a 2,500 sow unit?
So I can take that one, and I think Carlos mentioned a bit about it, and it's not easy to put a dollar value to sow mortality. We've looked at it in the past, and there's some data from SMS that Carlos has mentioned from Ron Ketchup Group, and when we did our math, we came to about the same number. So it's about 1% mortality will worth about $25,000 to $30,000 for 2,500 sow farm. So 40 to 50 cents a pig, $10 to $12 per sow, you know. But I think we probably missed some of the impact on performance over time if you have higher mortality. And I think Carlos mentioned about it. Those are seen in lower performing farm. So is it because of high mortality, or is it because of bad management we have high mortality? So I think there's some confounding factor. But at least, you know, that 40 to 50 cents a pigs or $10 to $12 per sow. So $25,000, $30,000 per year for 2,500 sow unit for 1 point of mortality. So if you talk about 3, 4, 5%, that becomes big number. And there's also the labor, I think on the employee, it's not easy to deal with mortality as well. So there's other factors that are not, you're not able to put dollar value, but that are there as well.
Mm-hmm. Good.
Yeah, I would like to make a short comment about this, and it's well, the percentage of sows that die or we need to euthanize is probably the most spectacular part, is the upper part of the iceberg. But when I see a farm that is having a mortality problem, I am more concerned about what I don't see. The situations of pain, the situations that are losing milk or losing fetus or small losses all the time. And this is something that is more difficult to quantify. In fact, many sows are early culled because of low productivity. That is much more important when you consider everything. So, of course, mortality is a very good indicator, but it's a very good indicator of other things that we are not doing well. So keep, of course, the figure about mortality, but do not forget that the most important part is what you don't see of the poor and bad things that you're doing at that farm.
And if I can add to it, I think Danny alluded to it, it's a vicious circle too, because there's the upfront cost of your sow mortality, but then you don't have the luxury to call on production. If you lose 12, 50% of your sows and your replacement rate is 50%, a sow mortality issue, and now you're having a hard time to manage perfectly because you don't have a choice.
Thanks very much. One thing I apologize for is everyone has met Carlos presentation, but I'm going to ask the panelists to kind of introduce themselves to the viewers, and I'll maybe start ladies first. Karine.
Sure. So Karine Talbot, working currently for Highlight. I graduated in 2008 from University of Montreal, moved to Manitoba. Now the Director of Animal Health at Highlight, supervising a team of 9 people. My work is mostly related to health, production, welfare, biosecurity of all the different divisions for our company. And I oversee all the veterinary needs for Highlight, which were located in Manitoba, Saskatchewan, in Canada, and North Dakota in the US, which is about or over 100,000 sows. And it's a wide variety of farms, 900 sows to 6,500 sows in size. I have conventional and loose housing, various health status, various genetic lines, and obviously managed by and staffed by different people. So sow mortality is something I concentrate on as a veterinarian, and I try to understand cause, variation, and why we see such a wide variation, I guess, within our system as well, and try to improve it.
Good stuff. Martin?
Yes, I'm Martin Bonneau. I'm one of the owner of Demeter Veterinary Services. I graduated in '92, worked for a production company, a genetic company, as a health and production director for about 10 years. Start my own practice with my partner Sylvain Messier in 2005. And then today our group, we have a group of about 15 vets across Canada and overseeing about a third of the pigs in the country. So nice to be here, by the way. Very good. Dan?
Yes, I'm Dan Bussières from Quebec. I'm one of the owner of Groupe Sarès and Nutrition Athéna. So started the business in 2004, 2005. I'm a swine nutritionist by training. Done a lot of research, still do a lot of research, a lot of production stuff. We oversee the feeding of about 5.5 to 6 million pigs a year in Canada. Also involved a bit in China with a group over there. So, and you know, like Karine said, or Martin, we are dealing with sow mortality as an issue, increasing issue in our system with customer. So it's a concern for us. So it's pretty good to have a chance to talk about it with the group here and to listen to a view from Europe on that end as well.
Good stuff. Thanks very much to the panel. I'll continue on. We have a question from Amanda that I'll throw out to the group. What are some of your speculations about why gilts are more impacted by heat stress? Could it be that they are off feed from the heat stress? They do not have the body reserves to compensate?
Well, I can go first if you wish about this. It's interesting that we have concentrated, we have 2 hotspots in South Sudan, the younger ones and the older ones. And I think that mostly it's related to a good number of stressors that we underestimate in young sows. We think that, well, they should die less, but probably there are a number of things mostly related to my understanding with not proper health care and not proper addressing the nutritional needs that they have, that is putting one layer of stress over another layer, and this is increasing the overall risk. It's interesting because we all know, well, the gilts are the feature of the farm, they're very important animals, and sometimes it's a kind of a black hole. We don't know almost nothing about them. In many farms, there are no recordings about if there's a treatment or there's ensure the amount that we are doing. Sometimes it's very difficult because we fed them ad libitum. So we all say that it's very important, but we have very few data about that. So probably these two things, and in particular, I would like to highlight the nutritional part, not only in terms of nutrients. Sometimes still we see some farms that are feeding the gilts with growers and finishers feeds, which is not acceptable. Of course, it's important the amount of quality microminerals. It's in particular for joints. We have seen that we have a lot of joints problems later on, but there is something that is very difficult, and is something that I see in many farms. Every farmer, producer, or even other colleagues, they tell me, well, in fact, I don't know how much a gilt is eating because they're fed ad libitum and we don't know very much. So I think that probably we are underestimating some of the stress factors that we think that should be minor, and in fact, they are not. So probably we need to pay more attention in terms of this general care, and also please put some data on gilts, they deserve it.
I think I agree on that, and I think we don't care about our gilts the right way. We take that for granted. So the age at breeding, how do we raise our gilt? They are more sensitive to heat stress because in lactation they're going to be more affected. They eat less already. They have large litter size. The body reserve could be a bit less. They're still a growing animal, but we have to care about our gilts better. And I think I'll let Karine or Martin come out about the health, but all about acclimation and how you bring gilts to your herd is really important as well.
Yep. Anything to add?
Yes, like Dan mentioned, I think acclimation, there's so many reasons for sow mortality and maybe why gilts are more affected, but I agree that sometimes we see them as now she's mature because we're breeding her, but she's not a mature animal yet. She's still growing up to a few parities more. So maybe we underestimate that effect. And yeah, disease that you have on your herd, maybe they're minor. Sometimes I hear, oh, we're high health, no PRRS, no myco, no APP, but there's other small bugs that can also affect them. So.
That makes sense. Yep. The question as well, it seems the main factor, and this may be directed more to Martin, but you all will know about it. It seems the main factor in selection for a lot of genetics companies has been number of live-born. Is there a difference that you know of between the breeds when it comes to death loss?
Very good questions. But I would say one of the main thing with like Carlos brought the point with stillborn, it's very interesting to see, but indirectly it brings the people also the quality of management around these sows, around farrowing, and make sure people do a proper job to get better farrowing on these sows, and then indirectly it will make these sow eat faster right after farrowing. These are all, in terms of genetics, I would say it's pretty hard to say. Of course, their sow will produce more piglets than others, but overall in mortality, when we look at that, the best producing sows, or I should say the best producing herds, tend to have less dead. In general, the higher the productivity of the farm, they tend to be the best also in terms of sow mortality. So that tells me that it does not, those high productive sow probably require more attention. But if you give that attention, if you give that animal care, if your staff is able to recognize problems faster, then I think you get a big benefit. It's like a very good point that Carlos brought also around, lameness, inflammation. I don't think we recognize that well enough and early enough, and we don't probably treat well early enough, and then we end up with a major problem. So I think it's mortality goes way above genetics.
If I can add on that, I think there's a lot of talk about that in the last couple of years about pointing some genetic line to be more prone to mortality, which may be true in some cases, but like Martin said, we have high mortality in every genetic and we have low mortality in every genetic. So it's, but I think one point that I want to talk about that we haven't talked too much is about the also increase in prolapse. Everything around prolapse, is also a big deal in bringing the sow mortality a bit higher. And again, there's some genetic company that has been pointed out as having more risk of prolapse. But as Carlos pointed out, everything is increasing since 2014. So all the genetic company have increased their genetic selection. They have changed the way they do selection or improving genetic selection. And that led to maybe a bit more at-risk animal for whatever reason. At the same time, we have better performance. So we gain on one side, we have more challenge on the other side, and we have to find the happy middle to make sure that we can deal with that. But I think the genetic one could be true, but it's everywhere. So there's something else as well on that.
Yeah,
one other
something.
Sorry,
Go ahead, Martin. Go ahead. Sorry.
No, just another observation. When you look at people that have research facility or R&D barns, that we call it over here, we tend to have more people, more presence, more experienced staff working in these facilities, and we tend to have better performance, less mortality. So it's there's something there. I think we need to go back to basic and make sure that the training and understanding and being able to recognize stressor is a big thing.
Makes sense.
Yeah, I'm of course I fully agree with that. People is everything. Theory is theory, but what happens in practice, it's because of the people. But what I don't want to forget is to say that we have introduced in most of the analysis that we have performed, some of them I have referred. We always put the breeding line within the model, and what we have seen is that there's not many interactions. This means that the effect is basically the same, could vary the amount of the effect, how big is the effect, but I don't mean a downbred in general is not behaving different from a PIC or from a topics or from a hyper or whatever. The effects are basically the same, could be more pronounced or less. But this is given a clue because sows are sows. Of course, they are different because breeds are different, but not so different to lead us to define very different protocols from one farm to the other, which is a good news for the vet, because if it would be the opposite, it would be impossible to manage.
Mm-hmm. Martin?
Yep.
I just wondered if you wanted to add in on that, anything?
No, thanks.
No, we're good. Okay. We have a question here from Jared. And he asks, in your opinion, where do we need to start as we design experiments to explore these issues individually? And then he's lameness, feed intake, housing, etc. for death loss.
Well, I think Jared's question is 10 questions in one, because and it's a very good one. One thing that I am very excited is that now we have new tools, new equipment, and I think that Gestal is one of them that allow us to run proper practical research, proper applied research with lower effort than ever. Traditionally, if you would like to run a trial in a commercial farm, I wouldn't say that it's a nightmare, but it's extremely complicated and very demanding in many cases. Right now, we have beautiful tools that with a bit of classical knowledge and a proper follow-up, we can, I wouldn't say transform commercial farms in research farms, but we can go 4 steps beyond, faster than ever. So we need this combination of our classical vet knowledge with farms understanding and with a bit of knowledge of these new technologies, in particular electronic and precision feeding. So I would say that this is a great opportunity for us to understand better the animals. We say to the farm staff, we need to train you, you need to understand better the sow, but sometimes we are, I wouldn't say blind, but we are not really understanding how the sow is eating. For instance, I like very much the position of Professor Bruno Silva from Brazil, that he states the difference between how a sow is eating when she's able to choose either in lactation or in gestation, or how we feed them, because we feed them at the time that we are in farm, at midday or certain hours. So I think that this lot of stressors and noise, a background that is explaining this sow's mortality, can be better understood than ever in the next years with our classical knowledge and this beautiful equipment for feeding that is entering on the market right now.
Good stuff.
One comment I have about research, it's not easy to do some research, and when you look at mortality, it's not easy either. If you do a side-by-side trial in a research farm, it takes a lot of animal. So I think what we have to go first is just gather data, and a bit like Carlos presented, stillborn, what are the factors that cause more mortality? And then we can go backward and do research on those factors. So let's say we reduce stillborn. So if we have a mean to reduce stillborn by doing research, we know it could help to reduce mortality. If we have a mean to reduce prolapse by doing research, then we know we can reduce mortality. If we have a mean to reduce lameness, we know it can reduce mortality. So it's not just looking at mortality, but the factors that are in play and getting data to understand that better, and then doing research on those factors. And I think, as Carlos said, we have the equipment today, we have the technology to do more and faster. And we do so. We have 2 research barns where we do research, but to do a overall research on mortality, it's hard. We have to dissect the factors that are causing the mortality and do research on those factors. that's how we see it. But we need to understand better those factors as well. So gathering data from large unit, large commercial farm, like Carlos is doing, like the US research project that was done in 2019 by Iowa State, all those things are important.
Okay. I'm going to follow that. We have a question from Jennifer Brown. How can we improve farm records and recording of removal reasons?
Well, I have a first straight answer. We need to standardize, because if not, every farmer or every vet is recording its own way. And I can call a sudden death or unknown or whatever for the same thing. So we need, I don't know, 5, 6, whatever reasons discussed by the Association of Veterinarians here or there or whatever, but we need to standardize, because if not, it's going to be almost impossible to really understand what's going on.
Okay. Anyone else?
I think that would be a good start, standardizing it, and I can speak as a system. We're trying to standardize, following up 30 sow barn. I can tell you this is interesting. But then there's the training on farm too. So you might have a good system and you have your 6 most common reasons you want to be entered. But you have to make sure people working in the farm, the staff, the manager, label the sow as best as they can. And as you've presented, Carlos, there's often more than one reason. And even as a vet, sometimes it is hard. We go on farm, we're doing the crops. It's like, oh, I don't even know how I would call this sow mortality. But at least if we can simplify it and train people on this is the primary reason, and unknown should be as little as possible. And a sudden death is a sudden death. At least those obvious ones, that would really help everyone, I guess, in the industry to understand sow mortality.
Mm-hmm.
Okay. Yep. Had one question here from Steve. Interested in your thoughts of the primary factors influence in periodontal disease, in brackets, nutrition, pellet quality, bar chewing, etc.
Well, I would say that this was, I wouldn't say a surprise, but almost, because I wouldn't expect that this was a problem in a sow. But when you see that 71% of the sows have a different degree of lesion, like in humans, because they have all of them. And I did not mention in the talk, but it seems that for instance, in older sows is more related to fractures. In younger sows is more related to lesions because of the stress, because they are chewing and biting almost everything. So it's not just that this is, well, it's a surprise and that's it. No, it's telling us 2 things. First, that this is a very painful situation, and probably many sows, considering the joint and lameness lesions and dental lesions, they are under pain too much time. And secondly, is again an stressor that could lead to a lower performance. So we can say that it's kind of a cherry on the cake. Oh, well, it's interesting. I didn't know this, but it's reflecting that these animals are experimenting a continuous situation of pain that is undesired, because an animal that is suffering is not producing. Of course, it's impossible to do nothing. I know that we have not a dentist for them, but made me understand better which are the situation that a higher number of sows that I would expecting is exposed. Pain, too much pain.
Makes sense.
Blair, there is something that I don't want to forget, because from the European experience, is something that is a tricky situation, and I would like to clarify from this side of the ocean. Is the question, because it's a question that is classical, and I have seen 3 or 4 questions related in the chat about this, which is group or stalls. Well, this is a tricky way of presenting the question. It's not group sows, it's the type of group you choose, because it's absolutely different. If you decide to group the sows and just feed in the floor, or just use stanchions, or just use large groups of 60, 80, or 100, or small groups, it's a totally different story. So, to my opinion, it's unfair to talk about group sows. if you're thinking to go from stalls to group sows, you have to be very careful in deciding the pros and cons of every of the systems in terms of complexity, in terms of the payback. Something that I have to highlight is go for low stress system, but mainly go for systems that offer quality data. Without that, we're not going to understand the sows in particular in gestation. So avoid the question, group or stalls. What group, pros and cons, preferably with data, versus stalls? That is the way I understand that the question must be placed.
Okay. I think what we did when we started to have group housing, there was a lot of different ways to do it. Some people went the cheap way, and with the retrofit of a barn that was existing, not increasing the square foot, the space, whatever. So I think the group was probably not well designed. Today we know better how to design group. So I think, yeah, it's the system, how you do it. And a well-designed sow group system should work really well in my mind. But a bad design is probably much worse than crate or whatever. So it's, I don't think, you're right, it's not group, it's about how you do it.
And then I can tell you that we have made a lot of mistakes in Europe during the last 15 years about this, and we have learned certain things. So it's very right. It's a question that we need to pay a lot of attention to make a good decision.
Okay, makes sense. One question here from Professor Bruno Silva. He congratulates you, Doctor, and he says, did at any moment for your studies correlated peripartum sow mortality to circulating levels of vitamin D, calcium, phosphorus, and also the type of hepatic metabolic disorders?
Good question. For me, it's something that I am extremely keen on know more about that, because the metabolic stress that a sow is experimenting at the end of gestation and during lactation is amazing. Because everything is happening too fast and in a very high degree. So I think that probably certain things, certain indicators, as some of the ones that he has mentioned, could tell us about immediate actions to take care to avoid later detrimental impact. In fact, when you have an animal that in less than a month is producing 35% of the body weight, and you expect that everything goes normal after that without taking very good care of the details, you're a too much optimistic person, probably. So that part that Professor Silva is highlighting is something that I think that in the very next years is worth to pay attention, because probably we need to learn, and we will see some surprising things about the metabolic situation of sows in this very demanding period, end of gestation and lactation.
Okay. I think I agree with that. We don't know enough, but I think Karine can comment on that. We had some discussion over the last 6 months a year about vitamin D, vitamin A, and things like that. And when we do some tests on blood level of vitamin D and level are really low, but the reference are not very good either. So I think there's a lot to learn, and we are doing some trial work on that, trying to understand a bit better the supplementation of vitamin D, A, or whatever. And it's very complicated because there's a lot of other confounding factors, but I think we need to do a better job trying to understand the impact of those mineral or trace mineral or vitamins on what we're talking about. So it's pretty it's not new, but it's hard to develop on that and to find the right answer.
Just a question here from Jason. Maybe I'll direct it to Karine and Martin. Jason's curious to hear more about body condition and how it may contributed to the mortality event related to the periodontal disease or cracked teeth.
Yeah, I'm not sure. I can start. I don't know how it would relate to the periodontal, because that's a new one for me. So when I do necropsy, I don't very often look at the mouth of the sows or a live sow. So that's one thing I'll start looking at. But on the body condition, that's, again, we were talking about nutritions and we were just talking about vitamins. I think that's one thing important. And we feed sow mostly as a group, usually. We just say, oh, she's now bred. This is how we feed a bred sow. She's in lactation. This is how we feed the lactating sow. We use general curves. Carlos has shown some very interesting data that this is how a sow eat. Well, no, there's individual way of how they feel, how they want to eat today, related to the temperatures, how she is, what she likes to eat, and we don't take that much into that account. The other place too is in gestation. We feed very often one diet over the whole gestation period, and there's a different need of a sow that is bred compared to 2 weeks pre-farrow. So that will all impact on the body condition. So it doesn't directly answer this question. I've not made the link there, but obviously if she's in pain, she won't eat that good, and that add to that. But just overall, I don't think we're feeding the sows to individual care, but I think the new technology now with Gestal individual sow curve, and we're slowly but surely moving in that way where we can feed individual sow what they need.
Makes sense. Yep.
Absolutely.
And also, you know, regarding, we know that poor body condition will have more incidents on prolapse. That was well documented as well. So of course, it's something that, like Karine well described, is the best we can do to prevent those really poor body condition will help to reduce mortality for sure.
Yeah, makes sense. One last question, and because I think we're going to have to wrap it up here, maybe for the group. Would lifetime pigs per sow be a better way to judge sow value?
Yes, yes, yes. You know, I've talked about that in the past, and again, Carlos he's the data man, so he should. But I think longevity, litter size is important, but longevity of the animal, and we do see that we can improve litter size by doing different things with the gilt, but sometimes by trying to push the gilt with higher litter size on the first litter, we compromise longevity over time, and the lifetime productivity is compromised. And we have very sound data to prove that. So I think, yes, lifetime productivity will take into account the performance of the farm, the sow, but also her longevity and the fact that she's not going to die and she's not going to be called, which is really important. So I think that's, and I don't know, Carlos, you can comment on that. Is there any good data system that will get you those data? Because we look at PSY, which is for me okay, but I don't think that tell us the truth about the true economic value of performance of a sow barn. That's my opinion.
Well, yeah, well, I would like to, in general, agree, of course. I think that we should agree on that. But I would add something. It's not only the number of piglets, but also the kilograms produced per lifetime. Because it's not only because you produce more kilograms, and that's mean more dollars immediately. The performance of a heavier piglet in the early post-weaning period is very different when you're dealing with piglets of 5 kilograms something or piglets of 7 kilograms something. And this is, it seems that it's not affecting very much, it's not worsening very much the sow's yearly productivity. This is something that we have seen in Europe, mainly because we were obliged, we need to go 25 or 28 days of weaning, and we don't have an impairment on that. But the quality of the piglet is much better, not only in terms of kilogram, but in terms of what we can do later with that piglet. If Blair, if you allow me a short comment about that, all of the rest of the questions that are in the chat, I will answer one by one later on, so I don't forget anything. And if you allow me, Blair, I would like to refer to a question of Dr. Pinilla that I don't want to forget because I think it's very important. And it's about what can we do with gilts in large groups, because they are suffering a lot. So they're bullied. This is the advantage of the small groups. In large groups, it's very difficult to deal with this. But with a small group that you can place almost anywhere, in our farm, we have made a small mini gestation for gilts just with one of these small group systems. So consider this when you're dealing that small groups are more versatile than the rest, and it's affecting very much the topic of this comment. Sorry for this second answer, but I don't want to forget that.
No, thank you for that, Carlos. Unfortunately, that's all the time we have. I want to thank Carlos for your presentation. Was wonderful. I'd also like to thank our panelists, Dan, Martin, and Karine. Sure appreciate your time on this. And I also want to thank our sponsor again, Demeter and Nutrition Athena for sponsoring. I appreciate that a lot. For our audience, I'd like you to please join us next week's program, which is going to be on mixing gilts and sows. So thanks everyone, and enjoy your day. All the best.